I'm gonna knock on the door. I'm gonna come in and tell my patient that I'm gonna put her on the bedpan, okay? So I'm gonna pull up her side rails. I've introduced myself and told her what I'm doing. I'm gonna wash my hands, pull my curtain, lock my bed, bring my rails up because I'm gonna bring her up.
If you do this, could you stay doing this? Reaching over?
This bed? This isn't the thing's reaching over, not me.
Remember you said you couldn't do that? You gotta go around?
I carried it around. I didn't drag it, but I do reach sometimes. I'm putting gloves on. I told you that you can pick whichever bedpan you want, and I like this one just because I have a handle that I can cooperate with, okay? So usually your patients have to go pretty good, like right now. So I'm gonna have her roll over on her side, or I'm gonna assist her onto her side, okay? If she was sitting up, like in a 30-degree angle or something, I'm gonna make sure she's flat. Back side is on the flat side, goes up underneath her. And I roll her back and make sure she's comfortable on the bedpan, so I position it a little.
This is uncomfortable.
It's uncomfortable right now because you're laying flat. I sit her up like she's sitting on a toilet.
No, it's sliding down.
She'll tell me it should be sliding down because your vagina should be falling into the hole where you should be trying to pee. Okay?
It's sliding.
I'm gonna give her some toilet paper, right? Because in this skill, we're all gonna assume that she's going to wipe herself. Okay? And then I step around the corner. Well, before I do that, I'm gonna put the bed down so that she's safe while I walk away, okay? And you kind of step around the corner and let her do her thing. And all you do is you step out around the curtain and just say, I would give my patient some privacy. And then the instructor is gonna say, okay, she's done, the call light's on. So you come back in, right, because you didn't touch anything. If you did though, you take these gloves off, put new gloves on, wash your hands in between. You're gonna bring the bed back up for her. I'm gonna lay her back down. Where'd the toilet paper go? Your patient has the toilet paper, and they can either hand it to you and throw it in the trash can, or maybe it's in the bedpan, whichever way she's gonna do it, right? Your patient can lift up. If you use this kind, she could lift her hips and you could pull it out, but we're gonna say that she can't, so I'm gonna roll it. But even on any other kind of bedpan, I'm gonna hold the bedpan before the patient rolls so it doesn't roll and dump onto the bed. And then I'm doing a whole bed change, right? I would wash, rinse, and dry her, and I just have to verbalize that. Right, she's gonna come back.
So you don't gotta actually do it?
No, you don't actually do it. Now you have two options, okay? You have this bedpan in your hand. You have this bedpan in your hand. So, do you want to set it down or do you want to take care of it right now? You all want to take care of it, so I'm going to show you that way, right? So while you've got it in your hand, state tester is going to come and pour water into it, as much as she wants. Okay, this is your urine now. So your patient is safe, right? Her bed rails are up. She's still up in the air. Would you put her down?
Yeah.
Yes.
I would put her down. So I'm gonna take my buttons, even though I've got urine in this now, I'm gonna put her down. And tell her I'm going into your bathroom to dump this. So you all know where my bathroom is. Okay, so for purposes, I'm just gonna show you out here. But I'm gonna take a paper towel from the bathroom, you know the table that's in there. I'm gonna put it on the table. I'm gonna take my graduate and set it down, and then I'm gonna dump my urine into this graduate, right? Because it might splash, that's what the brown paper's for. And I'm gonna measure at eye level. It looks like 175 in there, so I said that out loud to myself so that I remember. I'm gonna rinse this in the sink, like turn the sink on, get some water in here, and dump this in the toilet. Dry this out. Then I'm gonna take my urine, dump it in the toilet, get water in this and rinse it out, dump this in the toilet, dry it. Come back out, ooh, see, urine everywhere. Dry it all out, okay? Then I'm gonna come back to my patient, because I'm not done with my patient yet. You have a wet washcloth at some point in this skill. Your hands, sweetheart. She wiped herself. How is her hands gonna get clean? by me. So I'm gonna take my washcloth. It's supposed to be warm, but it's not warm. Don't even ask her. And I'm gonna wash her hands, okay? And I forgot my dry one, but I would dry her hands too. Put that in the hamper. I'm gonna take my gloves off so that I can finish my skill with her. So I would put my bed rails down, open my curtain back up, make sure she's comfortable, bed's low, wash my hands, and leave the room.